Story 1. It scared the hell out of me. I worked in a small private home for the elderly. Most of the patients had been there for a long time. I was stupid and took night shifts for 2 weeks straight to replace the night nurse who was sick. There were old lamps in those hallways. To turn them on, you had to stick a paperclip in the slot of the switch next to them. It didn't sound cool, but it was safe. There was one high-powered lamp at the end of each hallway. I carried the paperclip in my keychain. One evening, I arrive at 11 o'clock, take my report, go through my food and medication supplies, and turn off all the lights. The only source of light is from the light bulb on my desk and the rather creepy red exit sign that casts a red streak across the walls. I'm standing at the medical chart, filling medical bags, and I hear the whistling of air. It was winter and all the windows were locked. Then I hear some rustling and realize that it is a patient from room 3. He sometimes wakes up at night. His room was 2 meters away from me, so I decided to check if he was trying to get out of bed. I go into the room and see that he is sound asleep. Not understanding what I had heard then, I checked all the wards, and all the patients were asleep. I felt a little creeped out, and to calm down I went back to work. A little later I heard rustling again, but this time with my side vision, I saw some figure walking past me into the 3rd ward. There is no trace of my courage left. I take the guard who is watching the video cameras with me. He thought I was crazy, and together we sneak into the room. There we see a patient who is now sitting on the bed talking to someone who is not in the room. When I ask him who he is talking to, he replies, to the person sitting in the chair in the corner. Of course, I don't see anyone in the chair, the guard, and I calm the patient down and leave the room. The next morning, I tell another nurse about what happened. Before I could explain who he was talking to, she interrupted me. The person sitting in the chair in the corner on the right. It was so creepy. Later, I talked to the recovering night nurse, and she said it happens almost every night. I never found out the name of this person. That was the end of the night shift for me for the rest of my life. Story 2. I have many stories from torn sheets to old ladies in rocking chairs, but one of them haunts me to this day. I think that's when I really saw death himself. It was 1999, a late summer evening when it was getting dark closer to 12 at night. I stayed on duty with several nurses crowding the post. Distracted by the medical records, I looked up and saw this man open the double doors and enter the room. I remembered his clothes. He looked like he had been pulled out of the 70s and thrown into the noughties. Platform shoes, brown laces, orange, yellow, and brown checked shirt. He was white, with short brown hair, and his age was in his early 30s. Knowing that he was not a relative of anyone's patients or employees, I said, "Who are you and where are you going?" He looked me straight in the eye, nodded as if to say, "Hi," and walked on. I followed him with a glance, and he stopped at the edge of the patient bed and turned to examine them. He wasn't touching anyone or doing anything at all, just looking over the patients. Suddenly, the patient near whom the man was standing began to deteriorate rapidly. The staff ran to help him, and they all acted as if they hadn't seen this guy. He turned around and just as calmly walked out of the ward. I never saw which direction he went. I also ran to save our patient, who eventually died. I later discussed this man with other staff members, but no one ever met him. It's been 17 years, and I remember it all, as I do now. Story 3. My first job was at a small 35-bed psychiatric hospital in California. It used to be a place where surgeries were performed. And of course, people were dying here. When I'd come in on the night shift, I'd sometimes get a call from the nearest police station to see if everything was all right, just like that time. Of course, everything was fine, patients asleep, a normal night. But the police officer explained that someone had just called 911 from our hospital, and the extension found out that the call was from the arts and crafts room for patients. But no one goes there at night, not even the staff. It was always a creepy atmosphere there, and they used to perform surgeries there. The caller seemed to introduce herself and ask for help. From then on, it started happening once a month. There wasn't a lot of staff working the night shift, so as a supervisor, I knew exactly where each staff member was, because I was the one who helped them shift during their breaks. I'm 100% sure that neither the patients nor the staff called 911. The hospital doors are locked at night, and to get into that room, you have to go through 3 doors protected by different passwords. Story 4. I work as a nurse in the intensive care unit. A woman in her 20s was admitted to us with serious cardiac abnormalities, and then she developed acute respiratory failure. She had never had any cardiac or respiratory problems up to that point. We had to put her on a ventilator. She was conscious and sedated. She could not talk and could only nod or shake her head answering yes or no to questions. One night a patient died in the room next to hers, and his body lay there waiting for the orderlies to come and take him to the morgue. The door had a curtain, so the patient couldn't see what was in the next room. When I went in that night to check on this patient, I found her in a panic. She was shivering and covered with sweat. I started asking her all kinds of questions to see if she was cold or hot, if she had pain somewhere, etc., but she answered no. Then I asked her if she saw anything that scared her, and she said yes. She wasn't on any medication that would cause hallucinations, so I started asking her about the details of what she was seeing. And after 20 questions, I wrote the following. It's a man, white, very pale, no left arm, fat, bald, and standing behind me. This was an accurate description of the man who had passed away earlier in the next room. I spent the rest of the night with this patient trying to comfort her. Story 5. I work nights at a long-term care facility as a nursing assistant. I have 2 men under my care, and both of them do not know how to use lights. They have severe dementia and debilitating Parkinson's disease. Still, there are lamps next to their beds, and they are bolted to the bed railings. One night I saw a light on in their room, and I went in there confused. I went in, turned off the light, and left the room again. But hardly was I in the hallway where the light came on again behind me. I entered the room again, and now saw that both lights had been unplugged and twisted off the bed railings, and were instead lying under their beds. I pulled them out, plugged them back in, and left again. Other than this incident, I had moments when I stood over the dying and felt an invisible hand touch my shoulder. This happened when I was trying to give them artificial respiration, still realizing that the person had already passed away.